welcome. Thank you for coming for Women in Aid and Development event, our May event. We have, for those who don't know, we have 4 to 5 a year. Our middle one, the next one will be July, and that's actually an online one. So we'll see the publicity go around about that. We just find winter is a bit more awkward for people, so we tend to have just one big online one. And then we have an October one, occasionally a December one. We'll see how that goes. But yes, so we're very excited. Like I say, we have lots of fun with all our events. Lots of just discussion with very interesting special guest speakers. We're very lucky in the calibre of guest speakers we get usually. So I appreciate you all coming to support the organisation, but also to support our guest speakers who have agreed to come along. So first of all, I'm going to do a welcome to country, and I'd like to begin by acknowledging the traditional owners of our land here in Melbourne, where we meet today, so the Wurundjeri people of the Kulin Nations, and pay my respects to elders past and present. So what we're talking about tonight for our May event is focusing on sexual health and reproductive choice programs. And what's happening with those in the development sector, obviously for women and girls across not only local, national, but also international communities. Access to equitable sexual and reproductive health and education services is a crucial aspect of what we do in international development and on the agenda of international development, and that impacts gender equality, it impacts health, and the overall well-being of women and girls. And we know within the development sector that the fight for women and girls is hard on every front, no matter where they are. Tonight, like I say, we have 2 guest speakers who have both worked in this field, but looking at different impacted groups. The pair of you actually come across in terms of different impacted groups in different settings. So it's going to be interesting when we start to have a chat and compare notes and discuss the commonalities, find out more about the work that you both do, how you got to those roles, and how that underpins women's choices in terms of gender equality, looking also just touching maybe on SDGs, on the Sustainable Development Goals, how that relates to those issues, especially health and gender, obviously, and how this work, you know, how we can break the cycle of poverty, which tends to be the underlying foundation of most of the issues in the development sector. Okay, so to our guests. Grishma, so Grishma Bista, newly appointed, she's like day 2, newly appointed Executive Officer, CEO of MSI Asia Pacific. It's a not-for-profit organisation focusing on reproductive choices for women and girls for what, 50 odd years that's been going, MSI, yeah? Yep. You've got more than a decade of experience in terms of leadership in sexual and reproductive health and rights, gender equality and development. You've served as country director, as you were saying, for MSI previously, having worked for them in Timor-Leste. But you've also had leadership roles here. Well, not here, but with Oxfam, not this building, but Oxfam, Care International, which is interesting, and the International Women's Development Agency, which we had quite a bit to do with, yeah. And then we have Anna Orozco. So Anna has, I'm hoping I'm saying this right, Anna Orozco, yeah? Yeah, that's fine. Anna has been part of the Burnett Institute's Young People's Health Group for 4 years, 5 years?
4 years, not as long as 10.
No, that's good. It's a different perspective. Dedicated to exploring young people's health in Australia through qualitative, co-design and quantitative research methods, which I want to talk to you about in terms of just focusing on research methodology as an approach. Your work primarily focuses on the needs of multicultural communities, is that right?
I work with multicultural communities, yes.
Excellent. Advocating for different levels of sexual, menstrual health, promoting sexual health and mental health and overall well-being. And we'll talk about a couple of the projects you're involved in, or you can discuss them. So, welcome, ladies, and thank you very much for joining us. It's going to be an interesting discussion. So, the way I usually start is that I get you to talk a little about, as I think I told you about your career paths and how you got to this point. So, Grishma, we might start with you. Basically, for each of you, but Grishma will go first. Give us just a brief insight into the pathways that got you to your current role, and why you were drawn to work in women's health, especially in reproductive health and sexual health. Yep. As a focus for the work you do, how you got going on that.
Sure. Thanks, Jill. Thanks for having me and Anna. But also thank you
for all of you for coming. And I know it's sort of late on a Tuesday evening for giving up your Tuesday evening, so much appreciated. I think starting with my story, I will try to keep it brief. You're going to have to
That's
stop
fine.
me.
Chat away.
Yeah. So I was born and raised in Nepal, so I'm Nepali. So from the perspective of why women's health, it was partly where I grew up, what I was seeing. I mean, I was very lucky and privileged to be in a family that was quite supportive of girls' education, girls' career. So I had, I'm literally standing on giants' shoulders, if I could say that, whether it's my aunt or my grandma or grandfather, whoever. So very fortunate that way. But I also knew that not everybody in the country that I grew up in is fortunate. I resisted it then when I was 16. My dad packed my bags and he sent me to a village. So I grew up in Kathmandu, which is the capital city. And he said, "No, you're going out to the remote areas and doing your work and volunteer at a school." And I was like, this is not a good idea, Dad, because I want to be with my friends. But there's no arguing with Dad, and off I went. And day one of me walking to the school that I was volunteering in, saw these two young girls carrying maybe 20, 25 kg load on their back. So they were not going to school, obviously. They were doing housework. I was all of 16 and I was supposedly helping out in English because I was from the urban center. So okay, English, you do help with English. And often the girls will disappear every month. And it took me a while to clock why. So of course, periods help. So I think that exposure just sort of really, was reflection on myself as to that's not been my life. And it bugged me quite a bit. And I think my moment came when I see a young mother die during childbirth, and that left quite a lasting impression when the village was an hour and a half from the city. So that stuck with me. I went to the US for my further studies with scholarship, and lots of Australian awards. I have colleagues who come here for that. I was fortunate to go to the US. So I stuck with it. So health, public health, reproductive health, because there's always itching, something has to be done. So I started off with the research around abortion was illegal in Nepal. Back then it is legal now. And I went back and did quite a bit of research and interviewed women who were jailed as young as 15 because they'd had an abortion. And again, sort of leaving an impression going, something has to be done. It is legal now, and the services. So I think the passion for women's gender equality, women's health started from just real lived experience and seeing it, lived and sort of seeing it. So I studied sociology, then moved into public health. And got a job in an organization in the US that was looking at reproductive health. When I was doing a master's, I was focusing on maternal child health. So I was very clear about being in a technical sector of reproductive health. I'm happy to explore further with all of you. My sort of splitting point, I call it, was someone tapped on my shoulders and said, "You'll make a good manager. I think you need to move away from your technical sphere." Partly because I think in our sector, there's a lot of passion. There's a lot of technical expertise, but management is a gap. And I was frustrated with that as well. So somebody said, "I think you need to be a manager." And I was like, "I don't want to be a manager. I want to do like a, reproductive health technical field." But once I did shift, it was a big learning curve. So less so into my technical field. I tried to hold on to health, but more and more, once you move into management, then you doesn't have to be in health. You can move around quite a lot. So junior management, mid management, senior management. And then I was in Timor-Leste for 8 years. I came back about 2.5 years ago, so very much well steeped into management. I was the country director of MSI Timor-Leste. So I was very happy to be working in the space that I'm passionate about, but also noting that management requires slightly different skills, and I'd picked that up along the way. When I came back, the board at MSI Asia Pacific said they don't have anybody on the board with operational field experience, whether I'd be interested to join the board, which I said yes to, because that was sort of quite a learning experience. And I was telling Jill, I had a moment where I said, do I want to do international development? So I jumped into domestic when I came back to Melbourne 2.5 years ago. I think, Ali, you were saying government and the whole is something else. I was gobsmacked by what I saw. So it was a not-for-profit that's supported by the federal government. It was a steep learning curve. The management stayed the same. That skill set, it's applicable anywhere once you're into management. But I was sort of like, wow, this is, the language is different. People are different. I didn't know a lot of people. And it was just sort of a meeting in Canberra that DFAT and ACFID had organized. I walked in, I was like, oh, my people, my language, which I felt like that. It was just, and I was like, what am I doing? Like, why am I ditching 20 plus years of experience for something that I'm curious and maybe this is not the time? So I actually had said yes to IWDA. And as I said yes to IWDA, getting to know the team, the sort of vacancy for the executive officer opened up. And it was actually, my family, lots of friends, but it was my daughter. I mean, I've got two girls, 16 and 14. And she had said, Mom, you should go for it. And I was like, oh, no, I've just started a new job. If you look at my CV, I don't hop around. That's not me. And then in the morning, she came back to me and she said, I want you to know the statistics of women who are CEOs. And if you don't hold the space and if you don't open the door, who does? And that really, I went, oh, maybe I should throw my hat in the ring. And I did. So very last minute. And here I am, day 2 of my CEO role, talking to all of you. So,
A very bright 16.
Yes.
So yeah, that's my story.
Very good. Anna, how about your part?
Yes, that's a very inspiring story, by the way. And thank you everyone for coming too. I guess my story, it's a bit shorter, but I am from Guatemala, that's in Central America, and I arrived to Australia almost 8 years ago. And you've been you helped me reflect as well as you were speaking about my career, because when I was in Guatemala, I went to a Christian school, and so part of the Christian values is to go and help the community, right? So we were involved in a lot of volunteering around the community in Guatemala. And I would go with young children to schools to help them with their classes. There's always staff shortage there. We would bring them food as well and give them complete meals. And I was also a very high achiever student. So I am very privileged to have parents and family who have supported me through all my career and throughout my life. And when I finished high school, I knew I wanted to be involved into sort of teaching or helping young people. But I never really thought about working in the community as a job, because in my head that was like, that's volunteering and that's hobbies and I want to do it of my free time. But I really didn't think it was possible. Not because I didn't want to, but in Guatemala, if you go into that path, what people tell you is you're not going to survive, you're not going to have the money to sustain yourself. So I really never thought about it, and my head was very focused on completing a degree in mathematics because I was really good at numbers. So I was like, okay, I could teach numbers. So I went to the UK because I tried to go to the US, but it was just too expensive for us. I got a scholarships, and even like that, it was not. I wasn't going to be able to sustain myself, and my parents could help me just at some point. So I'm very blessed and privileged to have Italian family, so I could move to Europe. And I spent my high school wasn't accredited or counted as full high school in UK or even here. So I had to do a foundation year. And during that foundation year, I did lots of mathematics, but I had some electives, and I took some electives in psychology. And my teachers told me that I was quite good at it, and I should consider doing a career in that. And that was the first time where I thought, oh, I can do something else that is just not numerical, or that is going to give me a certain path. So unfortunately, my family couldn't continue to support me in the UK because it was also very expensive. But my brother was here in Australia already. So when he knew that I was like, I didn't know what to do, he reached out to me saying that he would help me out here. He helped me with rent, and I got a scholarship from La Trobe that first year. And here in Australia, you're able to work as an international student. So that helped me to pay half of my fees. So I came here, and what got me super motivated is that here in Australia, it's a thing. You can do double degrees. I didn't know that was a thing somewhere else. So I did a double degree in mathematics and psychology. And when I finished, I thought I was gonna be sure of what I wanted to do and like choose either or. But I really like both of them, except pure mathematics. I just learned that I don't like pure mathematics. I like statistics. And there was this, but I always still enjoy working with young people, and I volunteer in a lot of places with young people, with international students. I will always try to help international students because as an international student myself, I experienced a lot of eye-opening experiences here in Australia. I realized I didn't know a lot of things, including a lot of my sexual health education was very limited. I learned a lot about abstinence, and that was it. So when I finished my degree, there was a project going on at Burnett with Megan Lim. She's my current manager at the moment at the Young People's Health Group. So that's where I'm working at. And she had this project around mental health with young people in Australia. And it was like during the COVID pandemic. I felt very attracted to it because I could relate. And also it has like a very strong aspect on statistics and also on mental health. So I was like, okay, cool, it's the perfect combination. I went for it. I really liked it. And I got exposed to the world of sexual health, reproductive health. I did not know about its existence. I mean, yes, but no, I was just very impressed because in Guatemala, this is really not a thing. And I didn't know there were places that will fund this kind of research and that you can actually do this as a job. So I got involved in it, and I've been doing some co-design work, which is meaning working with communities, and I also got involved in work with multicultural communities, which I've been really attracted to. And what you were saying got me thinking, because I think I never really understood why I was so attracted to, but when reflecting now, my mom in Guatemala, she still volunteers for this organization that works with women in domestic violence. My mom used to bring me to these sessions to help her out, and she will explain to me, and I always saw her passion. And just to telling your story with your daughter, I feel like, oh, that's so nice how, mother and daughter bond can motivate you so much. And I've been really involved lately into not only young people's health work, but with Ali, with the menstrual health team, we've been doing some work with young menstruators. And now I've started applying for a PhD to complete a PhD on menstrual health here in Australia. And I still want to continue my work with young women. And I think that's where my passion comes in. Every time I said to people that I'm from Guatemala, I get the question if I would like to come back to Guatemala, and that's something that I'm still wondering. But I like the work here as well, because I did not expect that there were going to be need for that here in Australia, if that makes sense. I thought Australia was great, it's amazing, there's no needs and issues. But we've done some work with young people and just listen to their experiences. It just makes me want to give them the space to find solutions for their current issues and concerns. So yeah, that's pretty much my path right now.
Amazing.
So do you think currently in Guatemala there would be is there the space to work in this sort of field? Is it set up like that? I'm not sure what the government and the governance is like in Guatemala. Would you be able to work in this field or in this space over there?
It's quite challenging. There is very limited opportunities, but there were some. Guatemala is a very religious country, so not long ago, like maybe 2-3 years ago, same-sex marriage became illegal. So it wasn't legal. It was just not in the legal constitution.
Yeah.
It became illegal. So just so you have an idea of what it is right now. And with Trump coming into power, I have my cousin's husband. He works with USAID, and he told me how many projects got cut, like their funding got cut. So usually most of the work in Guatemala, it's funded by the US, and at the moment it's very challenging. It was challenging before, it's even more challenging now.
It's being felt everywhere.
Yes.
Yeah. All right then. So thank you for that. That's really interesting, and it's interesting to hear the different perspectives you come from, but those sort of common points as well, which is really good. So, again, for each of you, what have you found are the main or the key areas, or the key issues rather, that impact women and girls? It does this.
Okay.
And the sexual and reproductive health choices in both of the fields you work with, maybe Grishma.
So many things, I think.
Yeah. I guess it depends on where we're talking about.
Yeah, I was going to say, and if I can sort of maybe generalize it, I think obviously patriarchy and the way the society is structured in many contexts, and women or women's bodies being seen as, you're there to reproduce and babies, and that's your role. So I think that certainly plays a part. And sometimes women internalize that as well, and sometimes that's imposed. So I think that's quite a challenge. I think if I sort of think of reproductive health and young women, it's also education. Education is a big challenge in terms of, again, understanding your own body. And very similar when you said it, I also went to a Catholic school, by the way. I was much later, and it was just really on the outskirts. The nuns would talk about getting your period. So you just had to, but I think we were flipping dictionaries going, this is what the word means. So yeah, I think education, knowing that. So I think if I can sort of say, agency of the women to recognize that they've got the rights to make that decision. They've got right to education, they've got right to access the services. And then I think if I think about, the patriarchy, the relationship aspects where sometimes it's not, then you're not empowered to question, and the society and the structure doesn't let you question that. And then you've got your policy barriers that really prevent young girls, young women. When I was in Timor-Leste, Catholic country, every time UNFPA would want to have a handbook out on reproductive health, it was always a challenge because eventually the government will say, no, we can't talk about condoms for young people, or young people's health should be out. So constant negotiation meant it's been final draft for a long time. So I think sometimes, the policy and advocacy barriers also doesn't help.
The culture also obviously comes in there as well, like you
Of
say,
course.
not only very very strong faith-based communities, but just different cultural aspects play a huge role in that in terms of
Absolutely.
either being traditional or
Yeah.
not wanting information out to the young people.
Absolutely.
Yeah.
And I think, like I said, I think some of that is imposed,
Mhm.
and some of that is girls themselves internalize that to sort of say, yes, this is my role, and I'm okay. And I think that's sometimes gets tricky as well in terms of trying to convince otherwise. And I think this is where education, that being able to question, and I always certainly say, if I wasn't questioning my own culture way back when, I wouldn't be here for sure. Because I could very well be like, yeah, this is it, this is my life.
In some ways, you're very lucky because it adds that extra element that feeds into your knowledge as well as your curiosity, doesn't it? Like in terms of your background and upbringing.
Yeah, absolutely.
Yeah. Anna, for you, the same question in terms of key issues, but obviously you're coming from a different point where you're working locally, but with multicultural communities. So what are some of the key issues for the girls, for the youth girls and young women, for them in this area?
So I'm thinking like a lot of things, because some of my work is also with young people who are disengaged from mainstream education, but not necessarily from multicultural communities, and also from multicultural communities. But I guess it's very specific, right? Because there's so many multicultural communities, and we are so different. But I guess very similar to what you're saying, those gender roles, education is really key, to give them that agency to make decisions. I guess one of the ones that I was just thinking is how education could help reduce sexual violence, and not only education to young women and young menstruators, but also to their classmates, you know. We've been doing this program around education on relationships and consent, and that is just so important. Young people in general, regardless of their gender, they had so many ideas within themselves that they thought it was okay, or like even just watching pornography, they don't know what to do with that. They learn from that. So if we don't give them the proper education, they're going to look for that education in different resources that we don't know if they are providing the right education. And I guess it's just similar with my work with multicultural communities. They had a lot of gender roles, and they learn a lot from their friends and peers. So I guess that's why I agree with you completely on education, because if we don't provide the right education and we only ban content, they're just going to be learning from other resources.
Yeah. So do you find, and this is something I find comes up a lot, whether we're talking about gender, whether we're talking about health, whatever we're talking about, that while we're obviously talking about, with our key focus is on women and girls, there is a role for the men in this. So and boys. So when you're talking about education and and talking in the broader class, you would obviously be talking about the fact that you have to provide to some degree or talk to the boys or the young men in terms of women's sexual health and reproductive health to a degree. Especially around domestic violence and that, and get them to understand that perspective. Does that work, or do you have that in your program?
Yes, our program actually includes more like pleasure as well, because sometimes we touch a bit about of like misconceptions, or like myths brought from learned from pornography as well. How some stereotypes might increase that violence against women, and just get them to reflect. It's been quite helpful. We had some young people in the session sharing their experiences, and I'm just trying to, everything comes to my head when we're talking about this. But yes, we definitely have touched on that. We touched on pleasure. We touched on the role on gender roles in sexuality. How we try to have a more positive approach in terms of using positive language, and trying to empower young people to learn, to look for their resources, empower young women as well, to learn about their bodies. And one thing that we've been thinking about including, we actually included it, but not in the official version, was about menstruation. We also include a section around menstruation so that young men can also learn about that. Because even with my friends, many of them didn't know about tampons, which is so simple. Men, yes, exactly. So it is definitely important to involve them in the conversation.
I think the different, just touching on that, the different cultural aspects as well. So, firstly, are you finding the boys are receiving that well? There is positive feedback in that, or are you having real problems? And is it based a lot on their culture, no matter which culture it is? Is that that's sort of a two-pronged question?
Yeah, I think it probably differs by culture as well. But my experience with young people is it can be challenging. They're not always receptive. And even for like facilitators, they will receive really harsh comments sometimes. So I guess it's not an easy job for whoever is going to go teach them. Some people are really against it. So yeah, just thinking, yeah, it's very difficult. But sometimes when you bring them examples, or when you have that discussion and you try to bring it into their personal lives, and they think about the people around them, they are a bit more receptive and more understanding. And when they hear, that's why it's so important to involve lived experience. But because when they hear people who have those experiences, they're like, oh, it's not something that I was told by my mom. It's something that my friend is experiencing. So yep.
Yes, and it's like many of these issues, it ends up being often generational, but certainly a mindset change that takes time.
Yeah.
So at the very least, you hope you've planted the seed to get them to go away and think about it.
Yeah, exactly. Yes, definitely.
No, and I think just from MSI's work internationally, globally, as well, when you talk about choice, it's very important. And, you know, particularly when we talk about contraceptives and what's available in terms of reproductive health, men can also be a party to that. Condom, permanent method. So when you talk about choice, it's very important to engage. Because particularly if you're working with a couple, then it's a discussion then of what you're doing. And we often find that I think with younger people, the conversations around consent, conversation around choice, conversation around relationship and rights, the earlier you start, the chances of that, when, I mean, you know, you might not be sexually active, but hearing that information, you often find that helps them make a decision and be supportive of a decision that your partner makes. So I think absolutely, I think men are a big part of this, and you know, has to be part of it. Like just isolating doesn't work.
No. And again, like I say, that is emerging. I'm certainly finding that's emerging in lots of different focus areas in international development as being a necessary part of it. I mean, we deal with, you know, gender violence, obviously, and let alone gender equality. But gender violence and that, where you have to have the men involved in the conversation and run sessions for them as well as sessions for the women in terms of what their rights are. Did you? I'm just curious. When were you in Timor-Leste?
2014 up until 2022.
Okay, so it's still, is it still the youngest nation on earth? It still is.
No, I believe South Sudan, and there's one more country that has come. So yes, still young,
still very young.
Still young.
Yeah. So I was going to ask about, in terms of the work you were doing, was there a, I guess, an impact or an effect from the fact that it was still a very young nation finding, I mean, it still is, finding its feet, in terms of its independence and everything, away from Indonesia and what have you?
I mean, I'm not a Timorese to be speaking, but I think just from my experience, absolutely. I mean, you know, it's on a path of nation building, lots of policies. One of the benefits of being a young nation, and perhaps sometimes a challenge, not just for Timor, is that there's lots of lessons learned. So everybody just throws it at you, and this worked, that worked, but then what works for Timor and the Timor context? I think sometimes it probably, I would say, was overwhelming, but lots of policies, lots of sort of the infrastructure and the system. There's lots of effort going in to build that up, and certainly for the health system
And there was lots
as
of
well.
rebuilding after independence.
Absolutely,
Yeah.
absolutely. And violence after that as well. So from a population perspective as well, and I think now we've got the younger generation that is that much more removed, and they've enjoyed stability versus.
So you're finding that change, or you found that change even then, yeah?
And definitely sort of in the workforce as well. You see a difference when you talk to some of your older colleagues who've been part of the independence movement, and their experience very different from some of the younger colleagues who, stability, jobs, and policies are being made. So I think in that sense, it's come, it's done amazing, but still on the path of nation building.
So they're more open to considering those policies when you come up with new or different policies, especially around issues for women and sexual and reproductive health, those sorts of health issues for women. Policies around that, they're more open to it now. You think they've come that far?
There's a bit of a push and pull. Church, the religious element still has quite a lot of sway, as much as the affairs of the state and church is separate. But so then when it comes to implementation is where eventually someone would say something, and there's a fear around sort of reprimand from the church. And I just recently got a message from someone who's in Timor-Leste saying, the deceased pope, when he came, it's also the interpretation. He was quite a liberal pope and said quite a lot of things, saying, matters are not black and white when it comes to reproductive health and, family issues. There's a lot of gray. But at the same time, you hear what you want to hear about what that gray might mean. And he was certainly there. And there's this he's motivated everybody to have kids, and you just go, yes, he did, but in the broader context of women has to be empowered and all. So it's sort of, so I think there's that gentle push and pull that is where I think an organization like ours always has to find that delicate balance. Because you are working in a context and you have to respect and honor that, but slowly, and particularly reproductive health, and some of these are fundamental sort of health issues and not necessarily a moral issue. And I think that was always the argument. But it's come leaps and bounds. It's doing some amazing work, but still on the path of nation building.
So I was going to ask you, and that's just sort of connected with it in some ways, in that in your role, there's a focus, I noticed in your bio, and so it's a focus on supporting local partnerships now, as well as obviously advancing policy in this area and stuff. I was just thinking what you were saying there about Timor, and that local partnerships are very important in any area of development. What do you find? Are we talking CSOs, or are we talking not-for-profits or NGOs? What are we, in terms of what's happening? And because one of the things that I thought of while you were talking there was that has there been, for instance, in Timor-Leste, as far as you know, the emergence of women's centres, and that they can deal with everything from health issues to gender violence or domestic violence. So, as an example, are they the sort of partnerships? What sort of partnerships are you looking at MSI?
I think for speaking purely for MSI now, and I can touch base on IWDA, and Anat can speak more on this as well. But I think for MSI, our biggest partner is the local government.
Okay.
And I say this because the suite of women's health, the service provision that MSI does, eventually from a sustainability perspective as well, has to shift and be part and parcel of a health infrastructure. So for us, there's a very explicit sort of what we call a public sector strengthening stream of work. So they're always our first call, whether that is for advocacy, policy changes, but also from a service perspective. And in that sense, not necessarily in all the countries we work in, but certainly in the context like Timor-Leste, PNG, where we do quite a lot of work with government to support. to support
Yeah.
government midwives, government doctors to provide reproductive health services. So from MSI, I would say the first local partner would definitely be government, because there's an explicit sort of
So local government, not national government. Like
local and
municipal.
national, municipal, depending on how decentralized and the context you're in. And I think after that, depending on the services that local CSOs or even local NGOs are providing, we would be looking to partner. But MSI's services and the model it runs is very much geared towards working with existing government infrastructures.
I would imagine that PNG would be a very particularly interesting case study. It's fairly unique purely because of the different provinces and the different statistics of the provinces in terms of gender-based violence, as well as just women's health and infant mortality, all that sort of stuff.
Absolutely.
Child death, mortality in terms of childhood and what have you. That would be a really interesting aspect in terms of trying to get, especially if you're going to the Highlands or to any of the provinces, getting involved with local governments or local communities there.
And the challenges, right? Even sometimes from the municipal perspective, who the leaders are there, whether you have access, whether you don't have access, depends on that as well. So the difference, even within not just PNG, I think in any context, I mean, if you sort of think of Australia, sort of Victoria has its own, the states are very different in terms of how it treats lots of things. So very similar in that.
And PNG and the Pacific work on a chieftain system too in terms of villages. So that then that works differently to just the local government. That's separate to the local government.
Exactly. And how do you, again, in terms of you being able to provide that last mile outreach, as we call in the service. So if you've got a village where the chief is not for it, it's very hard to even pitch a tent and provide that service. So there's always that balance of finding that. But from a long-term sustainability, definitely the government.
Does the extent of your work in terms of that sort of thing go to you then train locals on the ground, and are they women? In terms of, they're the best ones to go into the villages and to work with the women there. But they're not necessarily the ones to have the conversations with the chief or the local head of government.
Absolutely.
So do you mix that up, or do you try and capacity build women for those roles?
Capacity build service providers, so local service providers, and if it is sort of reproductive health services more often, and speaking purely in Timor, maybe more male doctors, but then midwives and nurses are mostly women, and there are other organizations sort of working with government to provide those skills and support. And like I said, certainly for MSI, there's a whole a channel, as we call it, that is focused and geared towards working very closely with the public sector system. And it is about building that skill, and then we're done. We're just providing quality support.
And I was going to ask Anna about the research for an evidence-based point of view. Just touching on that, one of the things, maybe not Anna, but most of us dislike about development work is the amount of research and data collection you have to do, which again in that field, whether it's Timor-Leste or PNG or wherever, that's not easy to do, to back up the work you're doing. So you'd have to facilitate that as well, trying to collect evidence.
I mean, MSI has put in a lot of effort into evidence and data gathering. There are challenges, not to say that, but every service provision, the data quality, it's real-time data that comes through that is visible and accessible to a range of staff. But having said that, I think the quality of the data, and I don't mean, you'd probably be able to speak, but the cleanliness of the data, which probably speaks about quality of data, and what we would call these regular data validation checks, etc., that needs to go out, is perhaps where the challenge lies. But then in terms of data collection, regular data collection, the proper way of data collecting, but still for the numbers that we collect, MSI, I think a lot of you would be familiar as well, has what we call an impact calculator that talks about for the number of services you provide, what are the unwanted pregnancies you've prevented, abortion averted. So all of that is quite a robust system. But sitting beneath that is your data quality, data validation, and that's probably where some of the challenges lies. But the system in itself is quite uniform across MSA International. Yeah.
So for you, Anna, in terms of, you said obviously you're into research and stuff, and research methodology. Your one of your particular projects is Young People's Health Group, which you were talking about, and that what sort of method? I mean, you're using across the board methodologies from what I've said before in terms of both qualitative and quantitative. But how are you finding that, and how do you go about doing that? And if you want to go into partnerships, do you use partners outside your project in terms of local communities?
Yes, actually, I was going to add on that, because what you said is completely true. Even in Victoria, you will have multiple areas where you will have to approach to local partners. In all of the projects I've been involved where I work with community, we always approach local partners, and not only one. And because reaching out to the community just like that, you need trust for the community to work with you. And the best way to approach them is with local communities, the local partners. So I work in our working group. It's mostly around, we do like a lot of quantitative analysis from online surveys. We have like this online survey that happens every year, and it's been happening for like 21 years now, where we reach out to young people and we ask them multiple questions around sexual health, alcohol, and other drugs. And we also ask them questions about policies or any interventions happening. So, for example, we've asked them about COVID-19, the vaccinations, the social media ban. What do they think about that? Age verification methods for pornography. What do they think about that? But we also do a lot of qualitative analysis, which includes interviews. We did a very nice project with Ali on the provision of period products here in Victoria. And we did interviews with people from Victoria. It was very insightful. We was just with young menstruators. No, it was not young menstruators. I'm sorry. It was just people who menstruate in Victoria. And our main biggest project, I guess, is we built a website and a program, face-to-face program from young people on sexual health and relationship education. And this was done with young people in regional Victoria as well. So for us to be able to approach young people, we had to first approach local partners, which includes schools, includes community health centers, youth hubs, even departments of the Victorian government, which most of the funding came from there. So yeah, what was your question again? Sorry.
It was about the methodologies, the research methodologies you were using, and then how partnerships might look into that. I was actually going to say, with what you were just saying, it's about the sample base. You said you do the surveys online, and then the qualitative's different, slightly different. But what's the sample base for the online survey? Do you just throw it out there? Is it the multicultural community you're just working with? Is it schools?
So we just sent it to young people in Victoria. And a lot of research has come up from that survey, because we don't target specific populations, but we do try to recruit around 1,000 people. We do have a variety of young people involved. So we've done some research in, for example, Chinese migrants that replied to that participated in that survey, or sometimes from that survey or other surveys that we've had. Based on their responses, we follow up and approach them to further the research with qualitative methods. So yeah, I guess Burnett Institute, one of the biggest strength is research, like the name says it. But yes, we do have a strong team in quantitative aspects, and yeah. we do have those research skills, and we've been trying to use more the co-design approaches now to to add on the work of quantitative, because we know that we're trying to move on to implementation as well.
So some of the work, and I think you messaged me when we were emailing that about the work you do, and when we were talking about partnerships and that, and the importance of them, would you be looking to either do research or to take some of the programs like the Youth Health Group in terms of an international context, or partner up with organisations to do that in an international context, or are you already?
Burnett Institute is already. Yeah, so there's a lot of work going on in the International Development Department. And they are also doing like a lot of research with a lot of data registries, and there's also co-design happening in countries like Philippines, PNG, Myanmar, Bangladesh. There's some training happening there as well. At the moment, I've been thinking about Australia because I'm like, I've traveled quite enough. I would like to stay somewhere here, like stable for a bit. But I've thought about even doing some research in Latin America because of my roots and because of I know the need. I mean, from my country, I know the need. I've seen it. I've been there. And I think most of the research in Australia focus on Asian Pacific because it's close, right? Makes sense.
That's where most of our development
yes. But yeah, definitely I'm open to the option. I just right now I'm like, I'm gonna stay right here. And then I can think about it. I just got my PR. I don't want to move away.
Fair enough. Yes. Fair enough. Something, and I mentioned this to Krishna before, something that came into my notifications, and Krishna touched on it before, last night on LinkedIn was an article or a statement yesterday from UNFPA, basically in response to the US's decision to deny future funding for UNFPA. So I'll just read this and I'll get your response to it. So UFPA, United Nations Sexual and Reproductive Health Agency, notes with deep regret that the USA has announced its intention to deny future funding to the organisation by triggering whatever the Kemp-Kasten Amendment. Have you heard of that before? Kemp-Kasten Amendment, whatever that is. Which the decision is based on unfounded, remembering this is a press statement from the UNFPA. Decision is based on unfounded claims about UNFPA's work in China that has long been disproved, including the US government, by the US government itself. Comes in addition to the termination notices UNFPA has already received more than 40 existing humanitarian projects amounting to some $335 million in funding. Thoughts?
Disappointing.
Yeah, disappointing. And I think one of the things, I mean, I was recently in Cambodia and Nepal as well, and certainly with UNFPA, that was, I mean, I hadn't read that statement in particular, but aware that one of the big impacts is on what we call family planning commodities, and UNFPA being a key sourcer and supporter, and of course for reproductive health. So part of me sort of says, oh, I'm not surprised, right? At the rate and the pace it is happening. A lot of it is, we're still unsure, and I think the sector is unsure of the long-term impact of what is happening.
I was going to ask you that, you know, obviously we don't know what it's going to be, but thoughts on what the potential impacts could be in terms of affecting some of the international programs, especially you guys or the guys, the organisations you deal with.
Absolutely. I mean, you know, in the immediate so my first reaction when I read here, am I surprised? No. Like, you know, at the pace and who's in the line of fire, what's targeted, not at all surprising. So I was like, oh yeah, okay, it's almost to the point. I mean, I shouldn't say this, but it was anticipated. It has happened. And you know, the lives that it costs, the immediate impact on women's lives, children's lives, for just the slashing and the quick slashing that has happened. has been huge. HIV/AIDS programming,
Mm.
whatnot. So health has been targeted, particularly women's health. So my first reaction is not surprising. I think what is for me, again, like I said, I think the long-term impact of cut, we're still waiting to see. But of course, in the immediate short term, what we're starting to see is it's impacting the ecosystem, right? So MSI, so to my point earlier, we don't receive USAID funding. We haven't received USAID funding for a long time because of the work that we do. But when they take away funding from the health system, but the fact that we work with the health system, so all of a sudden there's no supplies there. How are you going to train when there's no commodities there? So that impact is where I feel like it's still unfolding for many of the countries where we work. We're still piecing together to go, yes, there's a direct impact, but it's that the ecosystem impact, which I think we're still trying to figure out. An ecosystem in an interesting way. When I was talking to local partners in Cambodia when I went on a trip with IWGA as well, and they were just saying, we've lost allies because the funding stopped, so they've had to fold and close. So all of a sudden, key players that were in the human rights space, that were in the health space, are no longer there. And then when I was in Nepal recently, I was like, oh, why didn't I think of it? There's a loss of jobs, but also a lot of the economy is dependent on people coming. Simple things like hotels, conferences, cars being hired. So all of a sudden, like an average person's pocket has been hit as much as it just looks like a USAID cut. So, and I think that, as we know, when it's that broad of a scale, I feel like it'll be a few years, a bit like COVID, where it happened, we've done, and now we're like, what happened? And we're still piecing together that story. I feel like the USAID cuts would be in a similar way, that it'll be later. But having said that, my forever optimistic mind also says, I think there's a real opportunity here. Yeah, opportunity, particularly for, and if you talk about localization, if we talk about decolonial development, I do think for a long time, a lot of countries have been dependent on aid. You pull that out, I forget, I want to say Kenya, but please don't quote me on it. The government said, all right, we will push, so many X millions of dollars now in this because the funding has been removed. So I do feel like if it is done well, there's perhaps an opportunity there to really truly think about sustainability. What does dependency, codependency looks like? And I think that's the space where we're still reeling from it. But I would be very, very curious to understand, and I'd be very surprised if it doesn't push the sector. So I think the sector as we know it is probably going to look different as a result of that. I mean, Gates has decided to pull his drawdown by his wealth, he's pulled it forward by 10 years because he's saying the time is now, and not necessarily to stop gap, but he just feels like this is the moment. And I think that's a wait and see. And I do think there's perhaps an opportunity there that we're still first just reeling from the shock of it, that will probably push, because we're quite a resilient bunch as human beings. We get quite creative. Yeah.
But I was going to say that's where to me it's possibly two-pronged. Like you say, it'll draw more focus to the possibility of localization of assistance and moving out of dependency. But also what's the potential it opens the field up for other aid providers to step up, whether that's philanthropic, whether it's international NGOs, whether it's the UN, whoever it is, for them to actually step up, like you say, and everyone comes to the realization that maybe too many eggs were in one basket with the US, and we now need to change the way we do this. And that could actually be seen as an opportunity.
Absolutely. And for the government, like in some of the services, like I said, long-term sustainability, particularly from the health perspective, if it becomes part and parcel of government service, it sticks, it stays, it reaches a lot more. And I think that is the ultimate aim here. So to the extent that governments can fund, and I think again early days, but from my perspective, that's perhaps an area that is unknown, but perhaps even an opportunity there to push, or maybe to push towards that. Yeah.
True. Any thoughts, Anna?
Oh, I completely agree with you. Yeah, I was, as you said, not surprised. I was disappointed, not surprised, and concerned about the consequences. But I also I still have a bit of hope, as you said, when we are as humans, I think our nature is trying to find a way to survive and thrive. So, yes, I was also very hopeful. I'm also very hopeful that maybe we will find more partnerships, so we will manage to work together rather than just depending and like put all our eggs in one basket, as you mentioned. Yes.
But but in the immediate, for sure, the lives that has been impacted,
definitely,
when you have a decision like that is very real, particularly for women and girls when you talk about reproductive health. COVID, the same thing in Timor, right? The health centers pivoted into quarantine centers. So where the pregnant mothers supposed to go, and we worked with the government to change some of our clinics into taking these women in. But again, when you have to pivot, when you have to change, like the impact is very real. And we often, in making these decisions, I guess they have to be made at that time, but not realizing that access to these services stop when you stop the movement and all. And I think, again, here we're very fortunate to have the systems that we have, but in a context where there's no postal system that you can mail things or do things over the phone. When your internet connectivity is a real issue, you're stuck, and you're stuck whether you're wanting to take on a service, contraceptive service, take it out for whatever reason, you're stuck. I mean, and we did. I think there's a research not just on Timor, globally, that is being conducted around the sort of the spike, young pregnancies and GBV as a result of the lockdown. So these are just those consequences of
domestic violence.
Yes, exactly. Huge spike.
Spiked as well. It's the only thing that concerns me about the USA thing is that, like you say, the ripple effect. They talk about unnecessary programs and lots of fat in the system in terms of senior managers and that. It's the ripple effect from some of that funding gets used by local CSOs or local NFPs that are employing locals to do small jobs, tiny little organisations who they don't get funding. They can't pay. They can't pay for the provision service they provide. They can't pay their staff. Even if there's only 3 or 4 people in an office and they're all locals. That they've all lost their jobs. Even if they just get a small amount of US funding. That's the real impact I think we're going to notice. One other thing that came through to me from one of our comms volunteers, we had a message to ask this question tonight, and it's an interesting one. We discussed it via email. We discussed it in terms of both our perspectives to what this person has asked about the question, or the way the question's posed. So I'd be interested in your thoughts and your feedback. Question was, why has sexual health and reproductive rights come to dominate the development agenda? In many Asia-Pacific nations, communities are asking for food security, clean water, education and economic opportunity. Are we listening to them? Are we projecting our own priorities? Now,
great question.
I didn't necessarily agree with that assessment, but
I have a response.
We decided to ask the question and see what you thought about that position, but also the veracity of it, and is that what's happening?
Oh, please do start, because you say you have a response ready.
So it is not projection. For me, gender equality, sexual reproductive health is so fundamental, bedrock of everything we do, that all else fails. period. And I say that, you know, you've got nutrition program. You talk about a vicious cycle of malnutrition, where malnutrition is high. It's because women are, you know, there's no spacing, multiple kids and all of that. So it's a cyclical thing. And again, education. So you're talking about long-term development. You cannot have education when half the population is not accessing it because you've not addressed reproductive health. So for me, it's a great question. It's a very valid question. And oftentimes, I think it's understood as, you know, we tend to compartmentalize it. But I say this all the time, and just sort of, not because I'm working in this, if you're not addressing that from even a simple career perspective, you know, I was a mother here. I cannot imagine having more than 2 children and wanting to have, I mean, you know, everybody has a choice. I understand that. But in my context, my ability to get an education, all of that is because my mom has made a decision on children and how to raise her children. And I've certainly made decisions. So I just think if you don't address that, you're just missing the point of everything else that holds, because you've got empowered women, and for that, reproductive health is absolutely key.
I think my thing with the question was that the inference was that reproductive health, sexual and reproductive health, as it says in the question, dominates the development agenda. I would disagree with that in terms of the demise or the neglect of the others. There is still a huge amount. Where was WaterAid?
Yes,
so clean water and the wash program and everything else is still hugely huge things still being done there. I mean, and especially
we also do a lot of work on mental health.
Exactly.
You can't have wash without
Exactly.
Yeah, we can't deny it. Gender and health are the 2 core fundamental foundation elements of development, and they stem from issues of poverty. But even then, gender and health are very much foundational elements that everything else feeds off.
Absolutely. And I think to your question earlier around SDGs, and one of the reasons why we're not meeting them, or MDGs for that matter now, is because we're still lagging behind on gender equality and some of the reproductive.
All of them. I actually said to my students, I think it's going to be interesting because we are now in 2025, so we've only actually got 5 years left of the SDGs. It'll be interesting to see what happens when we get to 2030. Will they perhaps, will you put their hand up and sort of say, let's go for SDG Mark 2. Let's do another 15 years. Have we gotten that far, or are they just going to say, okay, let's just stop here, we tried that?
Yeah. I mean, and if anything, I would say, I think you were saying, you know, wash has just gotten, it's not trendy anymore. If anything, I would argue that there's a lot more issues that comes up where I think it's perceived as, you know, we don't need to pay attention to that. But for me, absolutely fundamental, and it won't stick. Your development's not going to stick till women are, if they're going to be left behind.
It's evolving the way the world's evolving, and the situations are evolving, whether that's climate change, whether that's conflict, whether that's whatever it is. So development focuses as well as practices are going to change.
Absolutely.
All right, well, I'm going to open up for questions and answers. I first have to offer an apology. At this point of the evening, I thank you very much for joining us. And I have a gift for each of you. And I've left it behind. My apologies. So I knew there was something in the back of my mind. I left home with everything I bring. It's like, I'm missing something. And when I got here, I will send them to little gifts to each of you. I'll get your details later. But yeah, so this should be where I give you your gift. And say thank you very much for joining us. It's been a real pleasure and a great discussion. So thank you both, Grishma and Anna.
Thank you.